to 5% of the company's total. BOCRA is monitoring the performance of the telecommunications networks, having procured a quality of service monitoring tool to independently assess performance of operators with respect to the quality of service. Through BOFINET, we are continuing to extend the national fiber backbone network, which is expected to be completed by August 27. BOFINET has also commissioned public internet Wi-Fi hotspots in such areas as shopping malls, airports, hospitals, and bus ranks. It is further aligning the rollout of the ICT infrastructure with retail operators. Targets have also been set for operators to roll out mobile broadband to villages with populations of more than 5,000 over the next 3 years. With respect to broadcasting, radio and television coverage is now available to some 90%, 97% of the population. The railways. Botswana Railways is currently implementing its turnaround strategy to address current and future environmental dictates. As part of this program, it launched the passenger train service BR Express in March this year, running between Lobatse and Franston. The teething problems that were experienced at the beginning of the service have been resolved and it is now running smoothly. In addition, Botswana Railways is refurbishing its station buildings in line with passenger train service. The works for Lobatse, Gaborone and Franston stations will be completed by the end of this month. In anticipation of future coal exports, as well as recapitalization strategy to provide better service delivery, BR is procuring 8 BD5 locomotives, which will be delivered in October next year. Roads. Madam Speaker, there has been measurable progress in the completion of mega projects. The bulk of the development budget was used for the continuation of the following roads infrastructure projects. That is Tonota Franston Dual Road, the road sector investment, which is output and performance-based contracts, and the Kazungula Bridge. The Tonota Franston dual carriageway has been completed and open to traffic. The Tapama Interchange Junction is anticipated to be completed by February 2017. With respect to the Kazungula Bridge project, temporary works on the Zambian side is now complete, whilst on the Botswana side it is at 86%. Overall permanent bridge works are at 13% completion. Construction on another road has also commenced, on another major road has also commenced on the Charles Hill Nojani Road, which started in June this year. ESP implementation in the road sector primary goal is to decongest public highways, especially the A1. Madam Speaker, to provide a more efficient and cost-effective integrated transport system, additional areas of implementation are at the National Multi-Modal Transport Master Plan and Greater Gaborone Transport Master Plan. In addition, we are developing a regional integration strategy to reduce the cost of trade and movement of people between Botswana and the SADC region and beyond, while increasing participation of Botswana transport operators and locally based regional operators in the regional transport market. Coming to aviation, Madam Speaker, the new air traffic control tower and technical block construction at Maun Airport was completed and handed over in May, while the Kasani Terminal building project is expected to be complete in April next year. In December 2015, the International Civil Aviation Organization conducted a validation mission which affirmed that the country had risen from 53.7% to 71.5% of effective implementation of ICAO standards. The new score places Botswana above both African and global averages of 46% and 62% respectively. In addition of our progress, Botswana was one of the 2 countries in Africa selected to receive the Council President's certificate at the ICAO Assembly in September of this year. Health and wellness. Madam Speaker, the provision of quality health services is a constant priority. To achieve this, government is focusing on 4 areas: organizational transformation, access to quality healthcare service, prevention with particular emphasis on primary healthcare, and economic diversification drive. Government is in the process of providing specialist medical services in the area of pediatrics, general surgery, obstetrics, gynecology, internal medicine to 7 district hospitals. Other specialist services offered on an ad hoc basis include heart surgery by the Mauritian cardiothoracic team and hip and knee replacement in partnership with Wits University. We also have an ongoing organ transplant program with India. By the end of June 2016, public medical supplies availability improved to an average of 87% for medicines. Training of health workers in supply management, coupled with effective contract management and strategic partnerships with USAID and other development partners, continues, and we build our capacity for sustainable medical supplies availability. Madam Speaker, emergency medical services are now available in 7 centers. The benefits of this have already been witnessed in our evacuation response to road traffic accidents. Adherence to health quality standards and the accreditation of our health facilities will further ensure that the services provided in our health facilities are of a high quality. So far, we have fully accredited 5 out of 6 health facilities that were targeted in Phase 1. Our Millennium Development Goals MDGs target for 2015 galvanize efforts to reduce maternal, infant, and under 5 mortality. Our immunization program continues to report coverage above 90% for most antigens. In 2015, we introduced the inactivated poliovirus vaccine, followed by the introduction of bivalent polio vaccine in April 2016, and the July-August 2016 measles rubella magazine and the deworming campaigns. Maternal mortality reduction is now an imperative. With improvement in our specialist staff complements, districts are now clustered into zones under specialists for prompt interventions to address complications and save mothers' lives. Madam Speaker, we are committed to eliminating malaria by 2018. This will be realized if communities in affected areas also participate fully and play their part. This includes allowing our spray teams into their homes, sleeping under insect-treated nets, as well as keeping surrounding areas clean. Government extends its gratitude to the Global Fund, which has availed funding support of approximately 52 million pula towards malaria elimination. With regards to TB, there has been a decline in TB deaths from 758 in 2005 to 492 in 2015. Despite this progress, TB still remains a major public health concern and requires all the necessary attention and resources. A human papillomavirus vaccine has been rolled out and is now included in routine immunization programs. Let me take this opportunity to congratulate Botswana for allowing their young girls to be vaccinated with the HPV. We are proud to have achieved coverage of 97% in our February 2016 HIV initiative. Non-communicable diseases remain our greatest health concern. To mitigate against the increasing incidence of non-communicable diseases, government continues to raise awareness on common risk factors, their consequences, as well as focus on preventions, screening, early detection, diagnosis, and treatment. This includes an ongoing breast cancer campaign to raise awareness and screen 80% of eligible women. To further address the increasing health security needs, Botswana has harmonized the integrated disease surveillance and response technical guidelines with the international health regulations for ease of implementation. This will strengthen capacities at district level for detecting, confirming, and responding to priority public health challenges. The establishment of National Public Health Institute is also aimed at strengthening disease surveillance and outbreak response systems. Coming to the alcohol levy, as at the end of September this year, 2016, the alcohol levy has collected a cumulative total of just over 2.2 billion pula. A follow-up to our 2012 evaluation of the impact of our alcohol reduction strategies, which had confirmed a reduction in consumption, is now underway. Both domestic and global statistics show that young people, more especially males between the ages of 15 and 35, are most vulnerable to alcohol abuse. Locally, on average, males annually consume over 2.5 times the amount of alcohol than females. So in terms of liters, it's 25 liters for male and 9.5 liters for females. I don't mean all at once. I mean over a period of time. Currently, 15 non-government organizations are being funded from the alcohol levy to offer free rehabilitation services to the public. With regards to the mobilization of ESP in the health field, the upgrading of 92 health facilities is being done in a phased approach in which 26 clinics and 5 hospitals are planned for upgrading in 2016-17, along with the phased construction of 534 staff houses. Madam Speaker, the opening of the Botswana University Hospital was delayed but is now anticipated to be finally open in the coming year. Besides being a medical training facility, it will further serve as a center for excellence for treatment. We also continue to explore and benefit from public and private partnerships from across our borders. To this end, there are plans to establish in Francistown a 150-bed hospital specializing in acute care by the Indus Healthcare Group. HIV/AIDS. As HIV/AIDS epidemic remains a major public health challenge, we continue to explore and implement innovative approaches for its control. We are amongst the first countries in the world to have introduced the Treat All strategy, which was launched in June of this year. As a result, HIV-positive individuals, irrespective of their CD4 cell count, are now eligible for immediate antiretroviral therapy. Botswana is also one of the few countries that are close to achieving the UNAIDS 90-90-90 targets. That is, 90% of HIV-positive people should know their status. 90% of those on treatment should be virologically suppressed. According to the latest data from an ongoing study, our current status with regard to the target is 83% of our HIV-positive people know their status, of whom 87% are on ART, while 96% of those on treatment are virologically suppressed. To further assist us in the eradication of HIV/AIDS, we have received a grant of $32,172,404 from the Global Fund for Youth Prevention Programs, Safe Male Circumcision, and HIV testing services. Social upliftment and protection. Madam Speaker, strategies and innovative to cushion vulnerable and disadvantaged groups against the effect of poverty are being implemented throughout the country. With respect to poverty eradication, small and medium-sized business projects have been introduced to provide income-generating opportunities. New machinery and equipment for small-scale manufacturing is currently being distributed to program beneficiaries, who are also being assisted to form clusters and cooperatives to improve business skills and market access. The Affirmative Action Framework for Remote Area Communities under the RAD program has also progressed. In terms of shelter provision, since the inception of the Housing Initiative in 2009-10, financial provision has been made for a total of 1,395 housing units for remote area communities, of which 823 are complete and 572 under construction. Madam Speaker, I'm happy to note that the revised National Policy on Disabilities 2016 was tabled before this Parliament, which provides a blueprint mainstreaming people living with disabilities in all sectors of society. It has also been just over a year since the implementation of a monthly disability cash allowance. To economically empower people with disabilities, government has introduced a disability entrepreneurship training program to improve uptake of our economic empowerment schemes. Let me further take this opportunity to extend my gratitude to all companies and individuals who continue to economically support programs and projects that are aimed at empowering people with disabilities. Additional social welfare programs continue to assist different targeted groups, including, as we all know, destitute persons, community home-based care clients, needy students and orphans and vulnerable children, World War II veterans and old age pensioners, as well as people living with disabilities. The supplementary feeding program continues to be provided in the 755 primary schools, which have an enrollment of 341,864 students, and also to 966 health facilities, which have a total of 299,096 beneficiaries. In line with our drought declaration, government is providing a second meal at primary schools in remote area communities and rural districts. Provision of double food ration for other vulnerable groups, such as under 7-year-olds, TB outpatients, lactating and expectant mothers, is also being implemented countrywide. The pre and primary schools menu is under review to move from supplementary to full feeding. This will include food commodities that provide wholesome nutrition with the Homegrown School Feeding Initiative of purchasing food commodities found in their localities. Government continues to procure agricultural produce for primary school pupils. The initiative began in 2009 as a way of promoting agricultural production and livelihoods amongst subsistence farmers. During the harvesting season from April to June, just over 9 million pula was dispersed this year for the procurement of fresh agricultural produce from a total of 1,027 farmers. The Pelecheng program continues to provide temporary relief to unemployed Botswana across the country. The program also supports various initiatives such as crime prevention volunteers, special constables under Botswana Police Service, wildlife volunteers, waste management volunteers, and monuments custodian. As of July 2016, a total of 63,688 people were engaged in this program. Rural development. Diversification of the rural economy can foster job creation by creating resilient communities. In this regard, our rural areas are being transferred through the provision of social and physical infrastructure such as roads, schools, health facilities, water, and telecommunications. Continued support for such transformation is being driven by the Rural Development Council. Gender. Government continues to give priority to the promotion of gender equality and women's empowerment by, among other things, the domestication of the Convention on the Elimination of All Forms of Discrimination Against Women. We have also adopted the National Policy on Gender and Development, which promotes gender mainstreaming for sustainable development. To facilitate effective implementation of the policy, the National Gender Commission has been established and launched in September of this year. We further recognize the need to be proactive in eliminating gender-based violence. To this end, we have piloted a gender-based violence referral system, which allows referrals to be made electronically, relieving survivors the ordeal of having to repeat their story to each and every service provider assisting them. The Women Economic Empowerment Program has expanded over the years from a budget of what was 300,000 pula per year, which supported 20 women organizations and businesses, to a total of over 30 million pula, supporting over 600 beneficiaries. Skills development. Madam Speaker, government has further prioritized technical and vocational education and training to drive the economy through the provision of requisite skills. Associated initiatives include the development of a policy framework and technical and vocational education and training and review of TVET circular curriculum to revitalize quality of training. To specifically reduce unemployment and shortage of schools amongst the youth, more youth are also being enrolled in various apprenticeship programs through Madiriro Training and Testing Center. These apprentices expose learners to real work experience that increases their employment prospects as well as skills to become self-employed. In addition, the Construction Industry Trust Fund continues to target unemployed and unskilled youth, school leavers and disadvantaged groups to enable them to acquire practical competencies in building and construction trades. During 2015-16, 1,346 completed training at the Gaborone Main Center, of whom 1,050 secured employment in various building, construction, and allied trades. Another 330 completed training at the CITF Kazungula Mobile Training Unit, two-thirds of whom have already secured employment. Due to the high demand of semi-skilled and skilled artisans in the building, mining, and energy sectors, additional skills training programs are being introduced. Coming to basic education, Madam Speaker, the first phase of the conversion of 2 junior secondary schools at Zabong and Mahupo into unified schools has been completed, with admission of a total of 480 Form 4 learners. The new Maitlamo Junior Secondary School in Maun, which opened in this year, admitted a total of 360 Form 1 learners. In line with our education and training sector strategic plan, we have also extended pre-primary education to an additional 107 primary schools. This brings the total number of participating schools to 382, which are catering to 16,000 or just over 16,000 learners. Government continues to upgrade internet access in schools. This has included the introduction of Wi-Fi and mobile devices to some schools. So far, 60 schools have benefited from the provision of 50 tablets each, while 84 secondary schools now have Wi-Fi footprints. We are further assisting teachers to integrate ICT in the classroom. Through ESP under the basic education sector, progress has also been made with respect to provision of additional education facilities in the form of teachers' houses and classrooms. A total of 292 teachers' houses and 32 classrooms are currently being constructed, while more projects will continue to be awarded in the coming financial year. On tertiary education, Madam Speaker, as part of the ETSSP implementation at tertiary level, government is rationalizing public institutions in order to increase their efficiency and effectiveness. A decline in government-sponsored tertiary education enrollment and participant rate has been observed during the past year, down from 60,583 in 2014-15 to 56,447 2015-16. This is due to the limited government financial resources for sponsorship. Given the growth in demand for tertiary education, government is therefore exploring options for sustainable funding, including cost sharing. In order to reduce graduate unemployment, government is engaging employers to identify marketable skills. In this regard, specific sector plans have been developed for the agriculture, tourism, minerals, energy, and water resource sectors. As a way to further close skills gaps, government introduced the Target 20,000 initiative for the rapid upskilling of unemployed youth. This program commenced in 2015-16 financial year when 13,410 students were enrolled in 24 institutions, with course durations ranging from short-term to up to 3 years. As of August 2016, 1,370 students have completed their programs. Youth empowerment. Madam Speaker, government continues to support youth industries by financing startups through the Youth Development Fund, which has an annual budget allocation of 120 million pula. During the last financial year, a total of 1,032 projects were funded to a tune of 107 million pula, creating 1,613 jobs. In addition, as a deliberate policy change to improve the sustainability of youth businesses, exemptions and quick wins were introduced as part of our affirmative action in favor of youth businesses. Government remains steadfast in its commitment to promoting positive attitudes amongst young people to be responsible and self-reliant individuals with sound morals. To assist in this effort, we are collaborating with relevant youth organizations to promote such positive behavior. National Service and Internship, Madam Speaker, in the spirit of self-reliance, the Botswana National Service Program under the Ministry of Youth continued to attract young Botswana to serve in their communities. In 2015, the program's average monthly enrollment was 10,500, while as June this year, the numbers increased to 13,474. The National Internship Program was introduced to help unemployed graduates to develop workplace skills and experience. Enrollment levels in the scheme stand at 3,452. Archives and Records Management, Madam Speaker, the level of compliance to records management standards and procedures across ministries has improved with an increased transfer of records to record centers. And under library and information services, public use of our libraries has risen to an average of 280,000 visitors. An attraction has been the provision of free public access to computers and internet within libraries, which has bridged the digital divide for many. Currently, 66 public libraries have internet, and a total of 67,000 members of the public have been trained on basic ICT skills. The 24/7 availability of Wi-Fi access within a radius of 300 meters of libraries has been a success. The Robert and Sarah Rothschild Family Foundation continues to support the construction of local libraries. The program's 14th library is under construction at Charles Hill and should be operational by the end of this financial year. Water. Madam Speaker, government has established a program management office to oversee the implementation of water, energy and water projects, of major energy and water projects. The design of the project management methodology and process has been completed, whilst institutionalizing of the methodology is ongoing. Government has further finalized a comprehensive assessment of the national water supply. Implementation of the associated infrastructure for both the Khatlong and Lotsani dams has also been completed, while the associated infrastructure component for the Tune Dam, which includes the construction of a water treatment plant and distribution pipelines to 10 villages in the Bubira sub-district, is progressing. The connection and supply for villages in the Bubira sub-district is being implemented with the second phase of the National South Carrier Scheme, the North-South Carrier Scheme. This section of the pipeline that terminates in Palapi is complete and is being trial operated. So far, the reliability of water supply to the Greater Gaborone catchment area has considerably improved. Over the years, water demand in Greater Gaborone has greatly increased due to development. This has necessitated the connection of major villages surrounding Gaborone to the NSC scheme, including the Mamashia Kanye NSC connection project, which commenced in August 2014 and will be completed in February next year. Other initiatives to improve water supply and sanitation in the country include the Mound Water Supply and Sanitation Phase 2 project, Kanye and Molepolole Sanitation Project, Soronga Gudigwa Water Supply Project, and Shakawe Water Treatment Plant. The Masamba West Groundwater Development Project is expected to be completed in March next year. The due diligence and design review process for the Chobe Zambezi Water Transfer Scheme will also be completed by the end of the current financial year. The government, as you all know, is exploring the potential of water transfers with neighboring states. The Lesotho Highlands feasibility studies findings confirmed that it is viable to transfer water from Lesotho to Botswana. Both countries, along with South Africa, have agreed that further investigations to determine the possible options for the transfer, as well as related socio-economic and environmental issues, should be done. We are also exploring the feasibility of drawing water from aquifers along our borders with Namibia and South Africa. Energy. Madam Speaker, transitioning Botswana from an energy-dependent to energy surplus nation is being given extra impetus through the new Ministry of Mineral Resources, Green Technology and Energy Security. The Botswana Energy Regulatory Authority, which should become fully operational in the coming financial year, has been established to facilitate further expansion and diversification of the energy sector. Already, independent power producers are being procured for the development of an additional 300 megawatts by extending Murupule B with units 5 and 6. We are also in the process of refurbishing the Murupule A plant. Meanwhile, as the existing Murupule B is still undergoing remedial works, our energy supply is being supplemented by the Orapa and Motselagabedi diesel peaking plants. Moving forward, there will be a greater emphasis on the expansion of solar power and other green technologies to meet our energy needs. In this respect, a tender for 100 megawatt solar power station is being prepared.